Hi, everyone. Welcome back to UCLA Health's Medically Speaking. I'm Dr. Eve Glazier. Living with a chronic condition, or caring for someone who is, can shape everyday life. It's in the routines, the decisions, the trade-offs, and those quiet calculations about what's safe, what's worth it, and what matters most. There's no one right way to carry a chronic condition. For some people, it's front and center. And for others, it sits more in the background. And for many of us, it just shifts depending on the chapter you're in. Our guest today was born with hemophilia, a genetic bleeding disorder diagnosed in infancy. We're going to talk about how it influenced his childhood and his choices, what it meant to grow up managing risks that other people couldn't always see, and how he builds a full life and a medical career while living fully with hemophilia. Joining me is Dr. Shawn Whelan. Dr. Whelan is a primary care physician who brings a holistic approach to family medicine, integrating lifestyle, nutrition, and emotional health into every patient interaction. He also dedicates time to research, education, and advocacy around bleeding disorders, with the goal of improving treatment options and expanding access for patients around the world. Shawn, thanks so much for being here and for sharing your story. Welcome to the pod.
Pleasure to be here, Eve. Thank you.
To kick us off, let's just go way back to the beginning. Hemophilia is genetic, so I am curious about your parents. Were they aware that you were at risk?
Yeah, great question. So classic hemophilia A, the genetics of it will often skip a generation, and most often males would be affected. So my mom's father had hemophilia, and so they knew that she would be a carrier. When she was pregnant, they did have some early testing methods at that time to see before I was born if I might have been affected, and they did the testing and it came out clear.
Oh, wow.
So they were expecting me to be born without hemophilia. So I was born, no real complications, brought home, and then they noticed that after the circumcision I hadn't stopped bleeding.
Oh, wow.
And so there was very scary, and they had to rush me back to the hospital and get blood transfusions, and that was at the point that I got diagnosed with hemophilia.
Wow, that must have been incredibly frightening for them.
Right.
Well, especially since they had that, I guess what we call that false negative.
You're right.
Do you remember realizing, I mean, I'm sure you were quite little, but do you remember realizing, oh, my body works differently?
Yeah, I think, we kind of grew up in our own normal for a period of time until a realization happens that things can be different.
Exactly.
And so for me, what that meant was at a certain age when I was running and I fell and I hit my knee and maybe it was swelling up, I would have to go into the hospital and get an IV transfusion of the medication. And so that was what it was early on, was an injury and then going to the hospital. Wow. Initially it was like Children's Hospital in Los Angeles, maybe 45 minutes away from where we lived. Then a local doctor's office. Eventually, my mom was trained to give me those infusions. Wow. And after that, maybe I was 7 or 8, I learned to do those infusions myself.
Oh my gosh, when you were that little.
Yeah.
Wow, but I mean, so you must have had this realization, wait, I'm falling, my friend is falling, but I'm the one who actually has to go and get an infusion.
Right.
And just for everyone, do you mind explaining what an infusion is, I guess?
Right, so I think the general public understands people with medical conditions like diabetes need to inject insulin, or even now with some of these weight loss drugs, these GLP-1s, Ozempic, Wegovy, whatever, these are given subcutaneously. So you just put the needle kind of in a good fleshy part of your body, and you inject it in. Well, an IV, you can think about when you're giving blood, you're drawing labs, they have to actually find the vein, stick the needle in the vein so that there's a flow between the medicine, because that's where you need this medicine to be given is directly into the bloodstream. It's too large of a molecule to just absorb or take a pill or even inject subcutaneously at this time, but there's new treatments on the way.
I mean, that's not nothing. I mean, I just really want to point out, I mean, you're describing it, but I mean, you think about a little kid who, when they hurt themselves, right, like you as a young boy, getting an infusion, it's like that big needle, it's going into the bloodstream. And how long would you have to get infused for if you had an injury that required that?
So if we were lucky, we might get the vein right away.
Yeah.
But other times it might take several tries. Even sometimes we started off the initial office and they couldn't do it. Then we'd have to go to the next one.
Right, and you're a little kid with little veins.
So there was really thankful for like the Hemophilia Treatment Center that was available to help give the training for my mom to start doing the infusions.
So you didn't have to go, yeah.
What was really transformative was there's a Hemophilia Foundation of Southern California. They put on an annual summer camp. And you went out for like a week on your own, and I was 7 or 8, and of course I didn't want to leave my house for a week all alone, and my parents bribed me with a new Nintendo if I would go.
Love it, smart.
And you show up, and it was just like a normal summer camp, except after breakfast you'd have your medical check, and people, that was their time to infuse. There was nurses and doctors there to help them do it, and it was the first day that they said, okay, why don't you do it yourself? And it's like, what do you mean? Like, didn't they just look next to you and someone's doing it themselves, and you've seen it done so many times. They're there if you need you, and it just kind of gave you like the courage and the push and the idea that this could actually be done. And I did it, and I came back, and I kind of was infusing from that point on, and my mom almost felt like left out now. She couldn't do it.
She's like, I'm not needed.
And I was like, well, Mom, if you miss it, I don't want to be upset about you. I'd rather miss myself.
Oh my gosh, that had to be incredibly empowering.
It was, exactly. So that was like, I think, a really transformative experience of that empowerment. And I think that really kind of fueled my path of wanting to empower others, and they're taking care of themselves and their optimal wellness.
Oh, that's so rad. Let's step back for a second too, because I'm like so ahead in your story. I'm so fascinated, but let's just define for everybody, what is actually hemophilia?
Right. So hemophilia is a bleeding disorder, and basically the body lives in a balance between bleeding and clotting, right? So we need blood to flow into our tissues to bring oxygen and nutrients. Then we need to bring that blood back into the heart and get recirculated. So we want that to be flowing, and we don't want just like a clot to form and cause a backup. But when we get an injury, we get a cut, we need that blood to clot. So there's that balance. So people with hemophilia, the balance is out of order. The most common type of hemophilia is hemophilia A, and there's a missing protein in the blood that's part of that clotting system that basically helps the blood, create, if there's a defect, if there's a hole in the vessel that's carrying it, to mesh that. We could talk about the specifics and all the steps involved, but that's one of them, and you can kind of think of them as like...
We'll put a link to the clotting cascade in the show notes. I'm still trying to figure it out.
Basically, you kind of start with platelets, and those are sticky little discs, and those start the clot, and then you have a set of proteins that kind of form like the meshwork of like sewing together a patch, right? And so the hemophilia is, your platelets are normal, but you're missing that meshwork.
Right.
It's basically you can think of dominoes activating each other to make that happen. So you're missing one of those dominoes.
Right.
So you can kind of form a little bit of a clot, but it's not very strong. And so what will happen is people with hemophilia, they don't bleed like faster or necessarily easier, but they'll bleed longer.
Right.
Or like minor traumas that you would be healing might start to bleed, and those are called like spontaneous bleeds. So different severities of hemophilia based on how much of this protein you're missing. So it could be 0, it could be 2 to 5% or more, and so that'd be like severe, mild, or moderate.
So there's a real spectrum to
that. So those are the classic hemophilias, and then A or B based on which protein you're missing, and then there's other associated bleeding disorders like von Willebrand's disease, which can affect, actually the most prevalent, but it doesn't really present with as severe bleeding, but 1 in 100 people will have this. Often women are most affected with menses, and then you can also have other rare types of hemophilia and platelet disorders.
Right. And so the goal then when you get the infusion was to replace the factor that the protein, or what we call factor, that you were missing.
Right.
How long does a typical infusion take?
The infusion itself has gotten a lot faster. So they used to be like what we call like 20 cc's, or I don't know,
it's
maybe like a shot,
like
a shot glass or something.
Sure. I'm like, I went cooking, you went drinking. It's fine. Yeah.
But that would only take a couple minutes, probably, to push it in compared to other IVs. That might take like an hour.
It's a lot for a kid.
But depending on what complications they have, some people don't respond to that medication, and other ones they have longer transfusions that can last 30 minutes an hour.
No, and I mean, it's very clarifying, because I think I was getting it wrong about what exactly hemophilia is. I think there is a big assumption that you're like bleeding, faster. So thank you for clarifying that. It also then, though, brings to mind that there's a concern for internal bleeding. Like you mentioned spontaneous,
That's
but
right.
like bleeding that you actually just don't see, and that seems to be pretty risky.
Right.
That's where the risk is.
Yeah. So there was like that misconception always, like, oh, if you get a paper cut, you're going to bleed to death. It's
Right.
not like that.
Right.
But there's actually, when I bruise, the reason you're getting those colors, that's your blood going into your tissue.
Mm-hmm.
And so you need to form a clot there to stop that. And so that when that happens, with someone with hemophilia, that it's just not happening as quickly.
Mm-hmm.
So it's going to bleed longer,
Mm-hmm.
and that can cause issues. So it can be brought on with a trauma, and especially if that were to happen in a muscle and you need to walk, it's under constant stress. So it's not enough balance on that seesaw to get that clot. And when the blood goes into a joint, it's extremely inflammatory. So it'll kind of wear away the cartilage, and then you end up with arthritis. And so people with untreated hemophilia, the severe kind, by the time they're in their late teens, they have joints like they're 80 or 90, and they're needing orthopedic surgery and replacements and procedures.
And lots of times you're not even then like seeing this internal bleeding.
Right.
Did you ever have an experience where the bleeding, you didn't see the bleeding and it kind of went into joints or muscles? And
so luckily I was on treatment. So when you take the medicine, at that time it would last a half-life about 24 hours. So they got on, instead of just treating the bleeds when they happened, they realized we could protect the joints and reduce the amount of bleeding by taking it like every 2 to 3 times a week, right?
I see.
So I was on that regimen, and so with that I was able to do a lot more physical activities that people were saying, no, you can't do, it's too dangerous. So I was with my cousins, we had been skateboarding, and I kind of fell on my hip, and it didn't hurt that bad, and then they were going wakeboarding, and I'd never done something like that, and I wanted to go so bad. So it was a little bit sore, but I didn't think much of it, I kind of ignored it. And I basically just got dragged headfirst through the water, but never letting go. Didn't get very far. But when I woke up in the middle of the night, like my hip was just throbbing, and I could barely walk. And that injury lasted a few months before it could heal, because it's really hard to get around, and even with the medicine. So that was like a real wake-up call of kind of like, all right, not ignoring it, and then realizing that this could be there, and when sometimes you have to sit out in order to do more in the long run.
Yeah. How old were you?
I was probably like 12 or 13.
So up until that time too, I mean, had you felt like the risk of bleeding with certain activities or any physical activities, had you felt limited up until then?
Yeah, I was always kind of told what I shouldn't be doing, and those were the things that I felt like I needed to go do and to kind of prove myself. And so
and also fun.
Yeah, and they were fun, right? And they're around me, and just want to kind of be normal and quote unquote. But then you kind of realize, all right, like taking more calculated risks and realizing, okay, I wasn't going to be on the football team, but I could be on the tennis team, I could be on the swim team. Yeah. And just because something was necessarily like high risk, it really is down to the individual and how you do that. Yes. What your level of strength and agility is, how you engage in that when you're ready to take a break. So I think you can kind of get past these absolutes and really figure out, all right, what are your passions? What do you like to do? Yeah. And then what's safe, and then where can you find like that sweet spot?
Yeah, I mean, it sounds like there's this, this daily calculus. And I guess, the story about the skateboarding and the wakeboarding, I mean, I listened to it, and I guess from a mom perspective, but also it's like, I can remember when I was like a teenager too. I mean, it's really relatable. It doesn't, you're obviously not being reckless. You're just trying to have, fun, and you're just trying to then kind of create this over time, kind of really what the risk, risk math is. But it also sounds like you were just trying to be a kid, and that's where I wanted to get to. Where did you feel like you had downplayed that injury, or because of that?
I definitely kind of had like the innate FOMO syndrome, where I just didn't want to miss out on things. So
I don't blame you.
You kind of like hide the injuries and then sometimes pay the price for those later.
Yeah.
Right?
Yeah, because you were kind of glossing over like you figure out, okay, I'm going to do the tennis team instead of like, the football team. But how did that actually feel emotionally for you to be like making these decisions? Because you're a kid here, right?
Right. it was just kind of like at one point the reality. You know, at one point I just had to learn the lessons kind of the hard way a few times to know like, all right, which way can this go? And then you make the most of it. Yeah. Then you're like, all right, well, what is my arena? And there's still a lot there. And you enjoy that.
And there's a lot there. I mean, that's what I'm hearing you say, which is very cool, is that you're like, I figure out my arena, and there's a lot there.
Right.
It's both of those things. So you're not like, oh, here I'm well circumscribed. It's like, and there's like incredible things to do within there.
I think kind of like that it helped me to be more adaptive and find out, you know, you can find that enjoyment, physical pleasure in so many different ways, and whatever that means.
That's wonderful. Did you feel like, growing up, let's say around 12 when you were wakeboarding and skateboarding, I mean, what was the environment like among like your peers, like your friends? Did they understand what was going on?
So I think it was all the way back into like elementary school. At first, you know, it was something that I didn't want to broadcast or stand out or have people worry about me, I think was the big thing. It was like there was obviously understandably a lot of worry for my parents, and I didn't want to feel that. And so I might try to like hide it, but it was obviously important for like the people at school to know I had this if I were to get hurt and what to do, and also some of the other kids what's going on. So actually like made a video about it with my mom.
You did?
She like filmed me, and we like played that for the class, like I have hemophilia and this is what it means. And you know, I think that kind of helped get over some of the stigma and be like, oh, I can do this. And again, like with the Hemophilia Treatment Center and meeting other peers that had this condition and seeing, you know, that this is something not to have to hide or be ashamed of, and you can wear your medical alert bracelets for emergencies.
Right. You're like, and it's really cute.
Yeah.
Did you feel like your friends understood then? You know, kind of like even with those elements of, you know, I love the video, by the way.
Yeah. I think I had both experiences. There was, you know, I kind of grew up in like this little isolated neighborhood, and there was like a few friends, and there was a lot of, I think, kind of like bullying going on. And so actually whatever could be weaponized against someone at one point happened. So it was like, okay, you're a bleeder boy, or other derogatory ways of actually like teasing you because of it, which I think had nothing to do with the condition and more just about that unhealthy social network that was going on at that time.
Right, exactly.
But you know, you kind of you get past that. I think in high school and middle school and after that, it wasn't something that created a big problem, but it was also not something I would like advertise, right? Unless you needed to. Unless, okay, we're going on this snowboard trip in college. By the way, just so you know, if something happens, I have this condition and I take my medicine, and we're driving up there, and you might see me having a needle in my arm, and that's why.
No, it's wonderful because you're like educating your friends and your community, which is great. I mean, it's obviously very painful even from where I'm sitting to hear about, you know, any sort of, you know, brutal, you know, shaming. But and I'm sure, like, I can't speak for you, but most kids, especially, you know, in that middle school age, don't really feel like being singled out, you know. But I mean, it really sounds like you've been reclaiming your own narrative.
Absolutely.
You know? And I'd love to hear how kind of like you've constructed that over time.
You know, I think one of the important parts of our wellness of our lives is having a purpose, right? And I think that hemophilia actually gave me a sense of purpose early on. So just from an individual point, it gave me the opportunity to kind of overcome a lot of these boundaries and be successful at a lot of these sports that were maybe higher risk, but I found ways to do them with the proper treatment and guidance and finding the framework. Again, sometimes learning lessons the hard way again and again, but finding my way back. And then kind of seeing the bigger picture of like knowing what it's like to have this limitation and getting past it and learning to adapt with it and wanting to bring that on to other people. And so I was interested in science and the thought that they were going to come up with a cure for hemophilia. And so that brought me into pursuing medicine and then doing research on hemophilia, which brought me to Vienna, Austria, and then my subsequent medical career of kind of helping people live their best lives and not let things hold them back.
I love it. I'd love to, if we could, just like kind of even go back to when you were even thinking about being a doctor, I guess. So do you, I mean, and it's interesting you mentioned, you know, kind of people worrying about you, which sounds like something you kind of wanted to throw off at some point. But you spent years being that, I think, that patient. But now, right, you've written this new narrative, and now you're the person that, people trust and basically give their worries to you. So did you know you always wanted to be a doctor?
I think when I was a little kid, the first thing I wanted to be was like an inventor or a pyrotechnician, because that sounded cool.
That's so cool, yes.
And then, then you have to all right, what are you going to do as your career? And then I'm sure my mom was whispering in my back ear, like, oh, you could be a doctor, you could do hemophilia. And then, you kind of you make that presentation and you talk about it. And after enough time, you start to internalize it and you're like, all right, which way am I going to go in the world? Yeah. Well, that was a really easy one to fall back on, and all right, I'm going to pursue that.
You're like, I'm just going to default to being a doctor, right?
Yeah, I kind of tried my path between either the research side or the clinician side, and did a bit of both, and found my way into being more clinical. Was there
a particular kind of ever a particular doctor that influenced you, or a particular experience? I mean, you had a lot of experiences, by the way, obviously in this space, but anything that particularly inspired you?
Yeah, there was Dr. Bob Miller. He was actually a PA, but he was at Children's Hospital Los Angeles, and he just always seemed like a real ally, and that he was very down to earth, and he understood me and what I wanted and what the situation was, and there wasn't so much of the fear and you can and you can't do this, but it was like, okay, here's the situation, and here's how we're going to empower you, and what are the guidelines to make you successful and healthy.
So you're a family medicine doc right now. So for our listeners, it's a primary care doc, right? Takes care of everyone.
Right.
Families, kids, adults. Am I missing anything? A little bit of everything.
Women's health.
Yeah. It's a great specialty. Did you always know you're going to do, you mentioned, you had done some hematology work, which makes sense. So I don't know if you ever thought about being an actual hematologist.
Yeah, I was always going to be kind of a pediatric hematologist.
Right. Take care of patients just like myself.
Exactly, right. And so I got into started medical school, and through that process, I kind of loved everything and wanted to do this and that. And I realized I wanted a broader approach in the end. And I think kind of my experiences of seeing just something like hemophilia, it could sound very simple. Okay, here's a missing protein and we're going to give it to you. Problem solved. But there's so much more to that. There's the psychosocial aspect and how you're taking care of it. Are you taking the medicine? Are you making good choices? And all the other parts that go into health, and dealing with acute issues when an injury and needing some sutures, or chronic pain and managing that, which was part of that, and that made family medicine really appeal to me. Yeah. And I realized if I did want to also care for people with bleeding disorders, that would just give me a little bit of a broader toolbox and lens than just the pure hematological one.
Yeah. No, that's remarkable, and it makes total sense. And I know that you describe your approach as holistic, and I would love if you kind of explain what that means to our listeners. I mean, I hear you say a lot about kind of whole person care. Yeah. But break it down for us.
I mean, I hope that's something that's kind of becoming more of just kind of the standard of care than something
I think so. I hope
special,
so. Yeah.
Right. And it's just kind of what are the basic pillars of health again? Right. How's your diet? What are you doing for exercise? Right. How are you managing stress? How's your mental health and all of those things? How are you sleeping?
And how all these things integrate.
Yes. Right? So sometimes there can be one pill that seems like the answer, but if you go back into the framework and you start there, maybe that's not necessary, or maybe it is, but we can still work on those other things and just kind of make you the healthiest person possible, and just kind of keeping that big lens of how things can interconnect, that you're not too laser focused on just one particular aspect that's missing the big picture.
Yeah.
Right?
I even think with my own patients, I'm when I say I want you to be the healthiest you can be, I have to step back and ask them, what does that actually mean?
What does that mean for you, right?
What does that mean for you?
It's what's your goals? What do you want?
Yeah, I know what I think is healthiest, but what do you think is healthiest?
Right. And why do you want to be healthy? What's important to you?
Exactly.
And what's your motivation?
The only thing that's going to sustain too.
Yeah.
I think we also have to give, it's not a static prescription of you sleep this much, you eat these things. It's over time. How can we keep you, quote unquote, healthy? But what does that mean? Like you're saying, all of it, the well-being, the sleep, all of it, while you're weathering the everyday.
Right.
I love that, and I appreciate that. That's your approach. And it's really interesting. I went into medicine after my own illness in college, and at first I was like, I'm going to go into infectious disease because that's what what I had suffered from. It was like my big turning point. But in the end, actually, no, it was the people who took care of me and their approach to me as a person that really made me want to actually be a generalist. I really, really like to take care of patients over time, and it sounds like you do too.
Exactly.
I agree. I think it's interesting. I'm like asking you to break down holistic, but I also sort of I'm like, is there another way we take care of patients? But I think it's because we're generalists, we're primary care docs, that everything we do is whole person care.
Right.
But I do want to spell out for our listeners that we're not just there to be like, how is your liver? I'm treating your esophagus. Like, no, it's how it all, comes together.
Exactly.
Again, and I want to go back to like that risk math that you are doing every day. How do you incorporate kind of that risk math you are doing into how you counsel your patients about whether it's how they're living their lives, if they have behavioral changes, if they themselves have a kind of chronic condition?
Well, I can kind of see people on the two sides of the spectrum of I want to do everything all the time, or I'm lacking motivation to get things. And so I think I can be effective in helping people with that journey and kind of just realizing where they are. And so I see that athlete that I can really relate to inside that doesn't want to stop or miss anything, and their sprained ankle, it's like I can tell them very clearly firsthand, like, just taking the rest here is going to get you to do the most in the long term, and gives me that little extra level of empathy of really understanding what that's like to have to do that, and it's not easy.
Right, it's like not dismissive at all.
It's going to help them out, and they're going to get better faster that way and not turn into a chronic issue. Or on the other side of things where people are just really struggling to start building an exercise routine and new habits, and helping understanding like how great that is, but meeting them where they are and finding out, all right, why is that important for you, and what are some of the first steps you might want to take to get there.
That's great. Is there anything I guess on the flip side, anything you do differently, when you're in the exam room with patients because you've been a patient?
That's a good question. I don't know per se. I usually won't bring up like my personal experiences in most visits, but sometimes I do. If it becomes relevant, or like as the relationship continues, that I might share some personal stories that I think help strengthen the relationship and the understanding that we have, and kind of be relevant lesson for what they're trying to work through themselves. But through my experience as a patient, as a kid, I think what was really important was just feeling like the doctor was down to earth and not like in an ivory tower, but that I could feel comfortable and form a relationship, and that they got me. And so I try to do that.
That makes total sense. Can you think of a time recently when you kind of actually shared your own story?
A patient I was treating for like chronic migraines, using osteopathic treatment and treating their neck and trigger point injections. They were a really avid athlete, and then they had an injury, and then they didn't want to kind of slow down and stop. And so I was able to kind of share my own experience of how that, I get how hard that is, but this is what happens when you don't do it.
Isn't it amazing though that like when you share like that tangible story, like people like they listen in a different way, and you absorb the sort of advice in a different way.
It does kind of humanize the relationship a little bit, that
for sure
you're on the same level.
Right, you're like, I'm not just making this recommendation from like a textbook. Like this is like I'm a lived-in experience. Yeah, that's great. I also want to know too. I mean, because we probably both have patients who have lots of different conditions, right? And like as you were saying, like it sounds like Dr. Miller did this for you in terms of like what are your health goals, and we don't just like make like these like cookie cutter plans for people, right? We sort of like make we assess them, we talk to them. We try to, like, even when you're saying like with like diets and health and exercise, making plans and that work for them, and something that they can actually live with. I'd love to know from you, like on a practical level, what has helped you stay well in whatever you consider well to be, both physically and emotionally.
I tried to have like checklist of 5 things I do every day for myself. So that's going to be getting some sort of exercise, ideally at least like 30 minutes to an hour. I want to be eating generally well. That's actually not on my checklist. That just kind of goes, that wasn't never a problem. I always just kind of saw food as fuel for feeding the things that I enjoy doing. And so I wanted to make sure that was like a high quality, and it kept me going. But it would also be like stretching and making sure to, my flexibility and that I'm balanced, meditation for dealing with mental health, reading, getting some new information, inspiration, and then writing and then processing like my experience and having something to kind of track where I'm going over time.
This is amazing. That's a fantastic checklist.
Yeah.
You should have your own podcast. So, you, as we were talking about, you're not necessarily a pediatric hematologist, but as you mentioned, you're very involved in the bleeding disorder community.
Yeah.
And I think you mentioned you serve on the board of the Hemophilia Foundation of Southern California. I'd love to hear about just some of the work you do in that space.
Yeah, we actually had a board meeting last night, which was fun timing. But as a kid growing up, it was, I think, really foundational for me. Like I said, like finding community, coming to terms with who I am, help the resources it provided my parents to find other people and know what to do, and made lifelong friends there. And so the building the community and the wellness for the bleeding disorder community was just such a huge part that I was really happy to be involved with the organization. First, I was acting as a camp counselor at the camp, and then now in the board of directors. It's been a new experience of, okay, it's not just like purely medical or community, but the planning of sides and then the finance of sides and helping to fundraise and making sure that these programs go on and raising awareness. And so to keeping it going, you know, and helping kind of have an oversight and input into what programs are going to be most valuable for the community. So, that's been a real honor to be a part of that, and really great people on the board and what they do. Yeah. So they're a great organization to support that help a lot of people, and then they're part of they're nationally. So it's the Hemophilia Foundation of Southern California. Nationally, we have the National Bleeding Disorder Foundation. And we partner with them for a lot of the fundraisers and walks, and there's a lot of great information on bleeding disorders on their website, and then globally the World Federation of Hemophilia. Wow. And so looking forward to an upcoming trip for there, and April will be in Kuala Lumpur, which
I was just gonna say, and where is it?
Yeah.
Will be great. I mean, it sort of seems like too, I love picturing you sort of like doing, your incredible clinical magic, right, in an individual with an exam room, and then the way that you're scaling, your expertise and your advocacy and community on these larger scales. It's really impressive and really important. Do you mentor any kids? Have you ever taught a kid how to do their own IV?
Yeah, at the camp where it's like cheering them on. There's not much I had to do, just like it was mine. They've seen it done.
Is it full circle?
Like you can do this, and it's really cool to see that they would do their. At the campfires at night, every kid that infused for the first time, they get a big stick award, and so just like great. The community there is just so amazing and supportive. Like a lot of people without hemophilia, to support these kids, they would actually do an IV on themselves without injecting anything, just to kind of say, all right, we're going to do this too. We know what it's like.
Is there anything that you would want to ask kind of those of us who are not, who don't have bleeding disorders or who aren't in this community yet that, we should be doing, or we could be advocating more for, or raising awareness?
I think women with bleeding disorders is an important point of awareness to be raised, because of like those classical genetics. I didn't think women had it, but actually they can be affected, and like the amount of factor VIII can kind of vary hormonally throughout your life. So they can be presenting with bleeding, especially during menses and other like von Willebrand's disease, and so a lot of that is undiagnosed. Yeah. So probably like 1 in 100 women can have that, and
so just even awareness,
and even for the medical community to make sure that they're testing and thinking of that.
Yeah, and not dismissing it for sure.
Yeah,
that's super helpful. Okay, we've been asking for a friend section.
Okay,
this comes from our curious citizens. How can someone support a person with a bleeding disorder, or really any chronic condition, without hovering or turning them into a project?
It's a great question. I think just kind of being curious and just asking, like, how is this for you? Do you have any needs? And you maybe don't need to pry too much, and that's all. And they're like, no, I'm good with this. Thanks. Or
believe them.
Or maybe they'll want to share more and open up, and both of those are going to be fine answers.
Yeah, it's great, right? It really depends on what their answer is.
Right.
That's great. I mean, I really hear in your story too, like there's a lot of autonomy to be respected.
Right. Yeah.
Yeah, the worry, other people's worry is its own burden.
Right. I don't think they want to be made to feel like any different or that they're needing any more special attention or care than they're saying they might need. Right. But making them feel safe that if they did, that they could open up and feel comfortable talking to you.
That's right. They can change their mind.
Yeah.
Yeah. Let's take a step back and we're also then going to look forward. But do you have any kind of worries, when you think about, bleeding disorders today and just where they're kind of at in terms of diagnosis, treatment, research?
I think there's definitely like an older generation that didn't have optimal treatment early on, and so they're dealing with a lot of joint issues and getting connected with a good hemophilia treatment center where they have a physical therapist and a social worker and all these other resources to kind of help guide them through that is crucial. And if they're needing orthopedic work being done, that's available. So we're partnering at the Hemophilia Treatment Center at the Luskin Institute for Children. Okay, great. So we're working there once a month and partnering with them. And so that's just an excellent place. And so helping people that are maybe geographically separated to find that care.
Yes.
And know that it exists. And one of the things we're doing is going to try to set up a satellite clinic up for the Central Coast where I'm practicing in Ventura and making that more accessible, that kind of level of care and guidance. And then, of course, I'm really interested in international work too, and in places that don't have the access to the medicines and the new therapies that are coming available and how that can be administered in a more equitable way and all the finances and things that come into play there.
Yeah, and it sounds like you're definitely have been leveraging your own experience, but then especially in your board work, you're going to be all positioned to take this globally, which it sounds like it really needs. Is there anything that gives you a lot of hope? Anything you're really excited about?
Yeah. So when I was a kid, it was always gene therapy is going to come out. You're not going to have to do these infusions 3 times a week, and
gene therapy meaning, just for our audience, that I'll let you explain what it would be.
Yeah, meaning that they would basically insert the missing gene, which is the DNA that tells your body to make this protein that is the factor 8 or factor 9 or whatever is missing. They actually attach that into a virus particle that they engineer, and then that virus is targeted to part of your body, probably the liver, and because that liver produces a lot of proteins for your body that are important, it will be able to produce that factor, and you can just get one shot and maybe be quote unquote cured. So there's that, and so the therapies have gotten better and they're longer acting and more effective, so they can maybe just be given once a month. And one of the biggest problems actually is within what we call inhibitors. So basically 30% of the people that take the medicine, up to 30%, their body is kind of seeing it as something foreign and it's fighting it off. It's the immune system makes antibodies to protect yourself. And so that was the research I did, was looking to why that happens, and the treatment there is really difficult. And they try to just give large amounts of that medicine to get the immune system tolerant for it, hopefully, and keep those levels, and then using different levels of approach to help you find that balance in coagulation. And so there's newer therapies there that have come out that are actually very effective. So that population is in a much better place then with that whole coagulation cascade, there's newer therapies too that they might be able to make into a pill, and there's already a subcutaneous injectable that are being done for the inhibitor patients, and then it's really customizing these therapies and understanding what's individual. Okay, how active are you? How likely are you to get like a serious bleed? So how much level do we need to do?
Wow.
How old are you? What difficult is it to get venous access?
Right.
And so there's that level of individual care that becomes really important, and it's really exciting with the new therapies and tools that are going to be available.
It's so exciting. I mean, and it's so personal. I do want to just I did want to make a note, because you had referenced that, there's the treatment for hemophilia has evolved so much dramatically, over the last decades. And I just want to put in our notes for our audience that there have been hard lessons in the past about blood product safety, but the screening now is so accelerated and it's so safe. But we will be putting a lot of reputable resources in show notes for anyone who wants to, learn more. But that's fascinating, even because it is. Even imagining you as like that little kid, like giving yourself IVs, like that's a big deal to put the IV in your own vein. And so even the fact that there would be oral formulations to replace some of these factors. But again, too, I just think over and over again, too, and a lot of the guests on this show, we're starting to use this expression precision medicine a lot. And yes, that is at the detail of these genes and the cells. And it's like, how amazing is that to think that like you use a virus, like the little virus train, right, to like drop off, basically a new version of DNA that then gets incorporated. So all of a sudden you don't now have hemophilia. Is pretty amazing. I, as a clinician, meaning someone who kind of sees patients in clinics, I'm always like, oh, but then on top of it, it's this very personalized approach, which clearly you appreciated as a patient, and now you extend, to your own patients, right? So there's the precision care, there's the precision, person part of it as well.
Yeah, absolutely.
We're going to wrap up, but is there anything, first of all, that I didn't ask you that you wanted to share with our audience? I didn't want to shortchange our conversation. I know I asked you a lot of stuff.
No, it's been a great pleasure to be here and share some experience, hopefully raise some of the awareness of what bleeding disorders are, how you could support people with bleeding disorders, what's being done, and it's just a real pleasure to be here.
Oh my God, no, but especially how you've lived with it over time. I mean, and here you are, young, very young still, but it'll be interesting too
40
to see.
Tomorrow.
Happy birthday, Shawn!
Yep.
But it'll be interesting too, as like, what will it be like, as you grow, what I mean, and grow older, you know what I mean? What will hemophilia or this condition be like for you as you are 80, But it's really exciting to see how you live your life, and you're not dismissing, a chronic serious condition, but you certainly have incorporated it into your approach to life, right? And your approach to caring for other people and your compassion for other people. And I guess I do think sort of like kind of widening out to kind of other chronic, conditions that a lot of our colleagues and friends, live with as well. If there was a message that you could kind of leave with our audience about that, any ideas?
I'd say to, find the things that excite you in your life, the things that make you want to go, and be creative and adapt and find the path forward that is going to let you get the most out of your life and find meaning. And hopefully, if there's a medical issue that's in the way or hindering it, you can get the best treatment to overcome that, and then work with what you have and make the most of it.
Yeah, I love it. I love your arena and so much in that arena.
Yeah.
Thank you so much, Shawn. I mean, first of all, thank you so much for sharing your story. Really reminding us that a diagnosis can be real, but it doesn't have to be your entire identity. Again, I'm acknowledging though that for some people, other chronic conditions really are essential to their identity, but it's really great to hear that for you, the hemophilia is like this context, but not the reason, that you're, that you can't live. To our listeners, I hope that you're leaving today with more language about what's happening in your body, permission to build a life that fits you, and especially over time. We're going to include evidence-based resources, a lot of the community links that Shawn mentioned in our show notes. Until next time, stay curious and healthy, and we'll see you next time on Medically Speaking. Thank you so much, Shawn.
Thank you, Eve.
Gosh.